So we're going to start today with, basically I'll be talking about VMV. Sorry. Gavin, what is it you would like to say? That's right. So first, we're going to start with who we are. I am Laura. I'm the CEO of VMV Hypoallergenics. This one is...
I'm Madison. I'm her daughter.
And that one is...
I'm Gavin.
Right. So basically they wanted to join. But what we're going to be doing today in VMV is we're going to be talking about acne, getting deep into acne, as it were. Gino Gasperanza, 99. VMV Green Line for oily skin is one of my faves. Me too. That was actually the first one I ever used. So yay, twinsies. So I'll be talking first about VMV's products for acne. And then we'll invite Dr. Viralio Rowell, my mom, to come in and talk to us because there's so much going on now with acne, so much new stuff. So it's good to know. But I'll start off by saying that acne was really my childhood nightmare. So my acne got so bad, I used to lie about who my mom was. I'd say she was a doctor, and people would be like, what kind? And I'd say, neurosurgeon, because if they looked at me, I just had too much acne. So if I said a dermatologist, they'd look at me funny. And it started with, I was 10, and I loved a shampoo that had a really cool strawberry scent. So I started using it, and then my first acne kind of came out over here. And that was the beginning of my nightmare with acne. So what we always say at VMV, and this is true of any health thing, it's like I can't get the kids to sit down.
I'm sorry, I'm fixing the lighting because there's a glare in the background. There you go. Thank you, Gavin.
Sit! Okay.
Sorry. Maddie was annoying me.
Okay, so what shampoo and conditioner do you guys use? Right, but do you know which one?
Clark Wash.
Uses Clark. This is Superwash.
I also use Superwash.
Right, this is what most of us tend to use in the house. And in part, it's because, especially if your acne is like here, my forehead's so big, so this is perfect for illustration. If your acne is here, like on the back of the neck, around this area on the upper back, then, there's a chance it could be from your hair care. And that includes shampoo and conditioner, which can trickle down your skin, especially when you sweat, and clog pores and cause acne. It can also be from hairstyling gels and oils and whatnot. So look for non-comedogenic in everything that you use. You also want to look for hypoallergenic, frankly, allergen-free, because allergens can irritate the pore. Irritation can lead to infection, acne. And then we use a cleanser. Madison and Gavin use super skincare cleansers. I think Madison uses the Hydra Balance scrub.
Yeah.
Gavin uses, what do you use, babe? The Moisture Rich.
Yeah.
But anyway, we have the scrubs or the cleansers for different skin types. The green line is the one that's a favorite for people with acne. Or what I used to use for years when I was younger, and then my skin got drier as I got older, the ID scrub. And actually my favorite now is the 1635 facial scrub, because it's scrubby but not too much, which is good because my skin has gotten drier and I still get acne. Plus it smells yummy because it has coffee in it, and coffee is my friend.
Really?
Coffee and I are good friends. Anyway, these two things are also on sale now. Then toner. Madison was saying she uses Super Skin 2, no?
Yeah, Super Skin.
So I use Super Skin 3 still, with mandelic acid and monolaurin. The original formulation of this was actually clindamycin and retinoic acid, and we reformulated for two main reasons. One is clindamycin is an antibiotic, and like any antibiotic, overuse can lead to tolerance and treatment. Plus, you just don't want to be using that many antibiotics, right? It can lead to a lot of different problems. So we changed it to monolaurin, which anyway has shown comparable efficacy as an antimicrobial and on a wider range of organisms. And mandelic acid, and the nice thing about mandelic acid is it's far less irritating than most other alpha hydroxy acids. So it's also great even for kids like 9 and up, which is why we've all started at age 9.
1, 2, and 3?
The concentration of mandelic acid and monolaurin.
Okay.
And I actually use both. These are both my actual products. I use Super Skin 3 and then I use It Toner first and then Super Skin 3.
I'm starting also.
And Madison is starting this because she dances and so there's a lot of sweat, a lot of humidity, so she uses both. And then sort of secret weapons here are this magic guy that everyone loves, It Monolaurin Gel. I was sharing earlier in the pre-live that this is one of the formulations where my mom was like, oh, we're going to make an It Monolaurin Gel. And I was like, why? I don't even understand what that is. This is pointless. It's crazy. Of course, I was wrong. This is awesome. And this is interesting because when I was younger, people realized that sweat acne, pityrosporum folliculitis, is actually fungal. And so regular antibiotics don't work. So in school, in the dorm, I'd wake up at 5 in the morning and put the dandruff shampoo all over me. And it burned. So this is a great alternative to that. It's very effective. It's awesome. And
I use that after the toners.
you do?
Yeah. Like
You
put
use
the
toner and then this?
I put like the It Toner, then the Super Skin Toner, then that in the areas I get the most acne.
There you go. In case you're wondering, she's 13. She's a dancer, so she's doing that. Bigger cysts, red better spot corrector. I have an auto-inflammatory disease, so when I get big cysts when I'm flaring, I'll put it like right there for hours. And then Super Skin Moisturizer for your skin type is always a good idea. The reason for that is I think, in my experience at least, a lot of people who have acne tend to over-treat it and the skin can become very red and very irritated. So these products contain anti-inflammatories and other things to sort of calm the skin down. Okay. I don't know what mask me is, Mrs. J.N. Nab. Maybe you can clarify and we can answer that later. Gino, again, I'm on my 30s, used to suffer from acne. Hereditary. Yeah, acne can be hereditary for sure, and we'll get into that a little more. How to manage oily skin plus acne. So the oily skin is what you're born with, right? And sebum is actually a good thing. It's not necessarily a bad thing. And it's not necessarily what's causing your acne. So we'll get into that a little bit. But what a lot of people like to do is use the It Gel in part to help mattify the skin if it's feeling really, really oily, because it also cools it down. And this can be reapplied throughout the day as you need it. Okay, and then you end up with your Armada Sun and Light screen and a nice little trick that I'll share with you guys here. Actually, I'll get into that in a bit. Right now online at VMV Hypoallergenics.com, we have the ID line on sale and the 1635 line on sale. So these two puppies are on sale now. I think on both websites. It's worth going. And then if you want a teleconsultation with Dr. Baralio Rowell or any other dermatologist we work with, drop us a DM. We'll make it happen. And I'll end before calling your Lola. The last thing I'll share is a nice tip. If you, which actually came from her, if you are about to go on like on a Zoom call in a day or something and you feel a huge cyst developing, a nice thing to do is to take like a little tiny napkin or rag or whatever and stick an ice cube in it, like that. So put your spot corrector, put the ice cube in a thing, a little napkin, and then put some coconut oil right there. Like this is oil as well with monolaurin, so you can put some of that right on the tip. And let's imagine that there's an ice cube there. You basically hold it up to the cyst as a cold compress, and that helps reduce inflammation, and it just helps it go away faster.
I did not know that.
Yeah.
You want me to go get London?
Well, one last thing.
Okay.
If your acne is mostly around the mouth, chin, jawline, it might be perioral dermatitis, and switching to a fluoride-free, flavor-free, a lot of flavors are allergens too, allergen-free toothpaste can really make the difference. So that's basically it. Prevention, superwash and conditioner, the toothpaste, non-comedogenic makeup, and then your cleanser is the super skin cleanser of your skin type, or id scrub, or 1635 scrub, toner, id toner, super skin toner, and then for your moisturizer it could be id lotion, or the moisturizer for your skin type. Id gel, absolutely a great thing to keep in your arsenal, and red better spot corrector. Then your Armada, and that little trick that I shared with you guys about the VCO cold compress. And on that note, we will be calling in finally Dr. Veralia Rowell. We're going to be welcome here. See? Bye. Sorry, Mom. So much to talk about.
Don't turn it off so they think I'm still there.
Hi.
Hello.
Hi, everyone.
Hi, everybody.
This is Dr. Veralia Rowell, who's also our founder, who also happens to be my mommy. So we got to hang here a bit with the kids. Now we're going to hang with my mom. Basically, a big brain, as you guys know. She's a dermatologist, dermatopathologist, multi-published author, speaks all over the world, etc., etc. And she got really excited when I mentioned that, you know, we wanted to learn more about acne because there's so much new stuff on acne, and she knows that I went through this hell as a kid, so I'm excited to have her on here to help us.
Hi, everybody. So nice to see you people, I think.
We're actually streaming on Facebook and on Instagram.
Okay.
So, okay, we mentioned earlier that, so the anti-aging regimen I kind of discussed already, Joan Louise, but I will go through it again at the end of the live stream after she leaves. Very dry skin, suffering from acne, best moisturizer. We'll discuss that in a bit. Okay, so we'll start first with some basic information. The first question is, what is acne? Pimples versus blackheads versus whiteheads versus sweat acne.
Right. I'd like to answer that by saying first that there really is adolescent acne, which is when they go into puberty, when we go into puberty, and then there's the adult acne, which is after the age of 25. Acne is an amazing, progress in the things we understand about it. When I was younger, the very first fellow who talked about acne's pathogenesis was Dr. Albert Kligman, where he showed hyperkeratosis, increased sebum production, and the oiliness of the skin and all. Nowadays, it's still the same, except now there are lots of studies that have shown what in particular is excited or stimulated in that follicular unit. So going back to the two types, stress, that adult beyond 25 and puberty, they actually have very similar mechanisms. So in puberty, for instance, the genes, what you've inherited from your parents of being cystic or just very mild acne like in our family, etc. And so genes and hormones. Beyond 25 years old, it's also still your genes, but more so even the hormones. The difference is that the hormones that increase in the adult with acne is basically secondary to the stressful situations that you have in your life. Whereas when you're younger, there may be a little bit of a difference there for them. But again, common between the two of what stimulates the hair follicle to become active and then eventually to become inflamed is the fact that, number one, the chemicals in the air, especially now during COVID times, may form a stimulus for that sebum to become expressed more. And then the other thing would be, these are all internal, the diet. There are now many studies.
So what is acne? Is it an inflammation of the hair follicle?
Yes, it's an inflammation of the hair follicle, which in addition to the inflammation shows increase in sebum production and increase of inflammatory markers that are now being identified, that we in the future we should be able to target so that it becomes easier to
Okay.
control.
So if I'm hearing right, guys, there are lots of causes of acne, including your genes, including your hormones, but also external things like disinfectants that we're using. Also, things that you use on the skin that can be comedogenic, correct?
Right.
And because it's an inflammatory condition, your lack of sleep, anything that's inflammatory, right? Which we already know. Poor diet, lack of sleep, all these things are inflammatory and contribute to the problem.
And don't forget psychological stress. I just finished a chapter that's going to be coming out as an online book this month. And my assignment was to talk about diet and environment. So I'm going to share with you how this affects acne. The diet, if there is more of a pro-inflammatory profile in the kind of food that you're eating, which means a lot more of the red meats and and very
And
much
junk
less of
food.
fruits and and processed foods which have chemicals into them. So that's part of the diet. I actually just finished or about to finish an anti-inflammatory diet. That can I share this with them?
You tell me.
Okay,
you told
that-
me it's not
That
shareable
we
yet.
did with New York University Rockefeller. With Rockefeller University in New York, where we did biopsies at baseline and then
Okay.
after 1 month.
The bottom line is it showed that your diet, an anti-inflammatory diet, can really help the skin. And they proved that with actual tissue biopsies of the skin. So, which is pretty awesome.
Yeah, one other thing I want to talk about. I'm sorry. Go ahead.
I have to do this because if not, she'll really be here for 4 hours, which is awesome. But it's too much. Maybe we want to keep this bite-sized. So acne, acne we know as the traditional like pimples, right? But what is the difference like between a pimple and a whitehead and a blackhead and sweat acne and the other stuff?
Okay. We're talking about the various things that are in the atmosphere and the environment that can cause or stimulate acne. So the question then is, what is the difference between
Like
those
a regular-
little whiteheads and blackheads?
Yeah. What's a whitehead? What's a blackhead?
Yeah, a whitehead and a blackhead. That just indicates one of the primary things that happens in your hair follicle, which is hyperkeratinization. That means if this is your follicle out here, that keratin that it has is thickened. And this is because of a series of changes that occur in your hair follicle. Sebum is increased a lot, and then the things that come to you. One of the things that I found out in the more
It's a
recent,
clogged pore.
yes, it's a clogged pore.
Okay, so
the other
blackhead-
thing, yes,
Blackhead and whiteheads are clogged
Clogged
pores.
pores.
But whiteheads are open,
Closed.
Closed. Okay, so I'm gonna double down on this, and I'm sorry for interrupting, but we get this question so much. Whiteheads and blackheads are both clogged pores.
yes.
Okay, but whiteheads it's closed, and blackheads it's open. So actually, what's interesting that I've heard from her also discussed sometimes is people who say, I have so many blackheads. It actually might be hyperpigmentation within the pore.
Correct. Or erythema. So the after
Erythema is
effect,
redness.
yeah, after the effect of the comedone, you may, or the acne actually, the inflamed lesions tend to always be flattened already and clear, but they have redness still. That scar looks red for a while before it disappears. That's a post-inflammatory redness. But in addition, for people with brown skin or brown skin background, they may also tend to have hyperpigmented marks.
And then sweat acne is what's it called?
Malassezia.
Malassezia,
Right.
which is pityrosporum, but they like the name Malassezia now apparently. But sweat acne is not bacterial, right? It is fungal.
Right. Pityrosporum folliculitis.
Yeah.
Right.
So that's what I had as a kid.
Yes.
When we would use that
Yes,
Dandruff
when you
shampoo.
were doing
So we had-
playing tennis every day.
We have a happy balance between the microbes in our bodies, right? And this includes the skin. And so we have this fungus that gets along really well, and it's like Sesame Street, right? Everything is sort of a balance, and they get along really well. And if you sweat a lot, like I was really active as a kid, the fungus feeds on sweat and gets really excited. So it tends to throw off the balance and it essentially clogs pores. Is that what happens?
Right.
Okay.
What it is basically is that she's right, among the factors that can affect that organism, by the way, there are microbiota within our hair follicles and they're balanced. Nature always tries to balance that. The two most important microbes that can affect that hair follicle are the Bacterium acnes, is a bacteria, and they're basically balanced with the fungus, which is Phytosporum. But if you get irritated so much by the chemicals we were talking about, there could be a disbalance of it so that the bacteria could be killed, but the fungus thrives more. Right?
So if I can summarize very quickly, there are different types of acne. Acne is inflammatory by nature. It's an inflammation of the hair follicle. It can be caused by internal things. So certain medication that you're taking, the diet, mental health, not getting enough sleep. It can also be caused by genes and hormones, and it can be caused by external things, right? And that can be the microbial imbalance, let's say, or chemicals in the air that you're exposed to, or comedogens in the things that you're using. Very quickly, let's take some questions here. Mrs. Jainab was talking about maskne. Masks are interesting because, and I'm glad you don't use them as much anymore now. If you imagine the mask has anything that's irritating, an allergen or comedogen, you're keeping that on your face moist and hot for a while. So the contact is really long and might cause more problems than you'd like. So I would definitely be careful. Someone is recommending, if I have dry skin and acne, what to do? And why do you get acne with dry skin?
Usually that's from adult acne already, although some younger people can have it. And what happens with nowadays, one of the things that really stimulate that hair follicle is the amount of materials that we're exposing that skin to. So whether it's from the drugs you're taking, that you become photosensitive, or from the chemicals that you're using as a wash on your face, and you might be irritated by the preservatives there, to which added are the exposure to all these chemicals that we're using for bathrooms and gardens and your kitchen as well. All of those can stimulate the bacteria or fungus, and this dysbiosis is what it's called, will actually end up if you're having barrier repair problems. So with the barrier, that's the most superficial part of the skin. When the barrier is disrupted, it cannot regenerate as well, and so therefore what happens is you have a barrier repair defect, you don't keep the water that is inside, and so therefore you have dryness of the skin. So dryness of the skin is something that is basically due to barrier. I reviewed more recent literature and found out that the barrier, that psychological stress, most of you and you will say, it's because I have stress is the number one trigger for whatever. The truth is that the barrier is in sleep, in psychological stress. I was reviewing the literature and it says nobody,
it's really been proven that stress affects the barrier.
Yes, right.
So
stress as well as lack of sleep can also affect the barrier.
To some questions, I
It's
just want to
good
make
studies.
I want to make sure we get your questions in. To Joanna Ondoy, safe to use the oily skin products after having an Indian healing clay mask? I don't know, and it would be impossible to say because we don't know what's in that mask. In terms of safety of our products, if it's VH109 especially, sure, but there's no way of really knowing. We don't know what's in that mask and how it might, what it might be doing. Joanne Louise, in my mid-30s, battling acne all my life, also concerned about skin aging. The nice thing about, and what anti-aging regimen to recommend, I have sort of the same problem. My skin has gotten drier as I've gotten older. So I personally use the 1635 cleanser because it's not so scrubby. I do use I use ID toner for the acne, but it also helps the super skin toner penetrate better, right, in different ways. And then I use Everything, and sunscreen, and VCO. Me personally, that's what I use. If you go to vmvinskin.com, we have regimens that combine actives that deal with aging and acne, dark spots and acne, etc. Mariyat 101,983. We talked about dry skin and acne, so you want to make sure no irritants, no allergens to take care of the barrier defect, and for the acne itself, you don't want to use anything too irritating, like benzoyl peroxide, harsh antibiotics.
We actually need antibiotics, and for a long time, antibiotics was given orally for a couple of years or more, which induced either resistance or a photoallergy to some of them. So the most important thing, and the reason why we need to do that, is to bring back the balance of the microbiota in your skin, right? So nowadays, especially in COVID times, people are using a wash that has chlorinated hydrocarbons in it, or they're using sprays all over the house, which has a lot of fragrance and lots of antiseptics as well. So yesterday I had this Caucasian male, white male, who has been living in the Philippines for quite a while. And he showed me, he said, why is my face here having pimples and the skin is irritated, and now I seem to have an impetigo right on one side. So that is explained by the fact that he uses his mask every day. And this is a mask that you can wash. He actually washes it, and the soap, for instance, that he's using has antiseptics in it, etc. So it produces that irritant reaction that is both acnegenic, meaning from irritation of the follicle, you therefore then get more inflammation and get papules, pustules, and cysts, and the dry skin.
Right. Actually, on that note, we get a lot of questions at VMV about, hey, I can't use this ingredient, it's comedogenic. VCO, virgin coconut oil, is comedogenic. Stearic acid is comedogenic. The very short answer to that is a lot of the lists that you find online are based on really old studies done on rabbit ears. That, at best, were incongruent. The results were inconsistent, even with the same doctors themselves who redid the studies, and when they compared those studies, the rabbit ear results versus human results in actual use, really incongruous. So the American Academy of Dermatology, thank you for this wonderful research, in like 1989 or something, came out with a statement saying, if something is positive in the rabbit ear assay, at the end of the day, the best thing to do is to do a human trial. Check it on actual human skin. So a lot of these lists are based on the rabbit ear assay. So check for REA ratings. What you want is the Draelos human comedogenicity assay, or you want human controlled trials in actual use. Virgin coconut oil, very consistently on human trials, is not comedogenic. Stearic acid, a lot of the stuff that is classically online listed as comedogenic, check the sources. What are the tests that they're using as a reference? I want to get to something else. You mentioned cysts. You mentioned these, so we talked about different types of acne. Blackheads and whiteheads are basically clogged comedones. They're both comedones. One is open, one is closed. Pimples, acne is basically an inflammation of the hair follicle, right? So internal and external, anything you can do to reduce that inflammation is good, and reduce irritation, because then you have that problem of having dry skin and then having to treat the acne. Occasionally you do need an antibiotic for acne. You need to see a doctor if the acne is cystic, especially, because chances are it's internally caused. Chances are you'll need an antibiotic. But I wanted to talk about this thing because it really concerned me. I was sharing in the pre-live. Do you remember how you had a spate of patients where it looked like just a really bad zit, and it turned out to be MRSA? So what are some of the warning signs we can tell people that may not be just a zit?
Well, a number of people will even use steroids.
Oh,
A round
Oh,
face.
steroid acne is a thing.
Right. Steroid acne, the side effects on the skin is really terrible because over time of using a steroid chemical ointment on the face and around this area, because this seems to be a very common area now because of all those exposures we're talking about. But this is therefore something that you have to be very careful about is minimize contact with those irritants and allergens or photoallergens that are in your environment, external in there, and also in your own face environment with chemicals that may have these.
But when should I worry? Like if I have a lesion, and how do I know, like, oh God, this might require me going to the emergency room already?
A cyst that's big and inflamed and may have MRSA, right?
So, that's my son photobombing.
Going then to the steroid, as you continue to use the steroid, like what every patient will tell me, but it's the best one that will help me out and remove the itch or remove the redness. I said, yeah, but that's the reason why you're here to see me is because it no longer does. Over time of using steroids over and over again, whatever bugs you have, whatever inflammation that you have there, may no longer respond as well as when you first started it. Plus, the skin becomes thinner, and being thinner and with barrier repair problems, bacteria, in addition to those two that we already mentioned, bacteria can come in more, and that includes nowadays the MRSA.
Right.
There's another organism, by the way, which is a live-in, a resident, and it's a mite. Recently I gave it to a patient to use because we've done everything, and he was clear except an occasional spot would still have out. And I said, it's probably Demodex because we haven't paid attention to the poor bug. It's a mite that lives there. I gave her or the mother to try doing this. Use an anti-mite. She said, my son has mites. Yes, they have lived in mites.
Okay.
But the minute she did it, everything is now clear,
Okay.
just leaving little mites.
I'm going to summarize everything up until this point because it's a lot. Okay. Number one, acne is an inflammation of the hair follicle. Whiteheads and blackheads are both plugged comedones, blackheads being open, whiteheads being closed. Blackheads can also be hyperpigmentation in the pore itself. Cystic acne in particular can be caused by internal things, hormones, stress, genes, inflammatory practices, and food. So junk food, processed food, not getting enough sleep, mental stress, etc. And also you can get comedonal acne, which is the plugging of those comedones, right? So anything that is comedogenic. We also learned that things that are normally listed as comedogenic online, you really need to be careful to make sure they're not referring to the rabbit ear assays of the 1970s. They should be referring to human-controlled trials or the Draelos human comet something. Basta Draelos or human-controlled trials, not the bunnies. Leave the bunnies alone. It's just not consistent. There. You also want to make sure to avoid irritants and allergens in your products. We're already getting exposed to them a lot with disinfectants and the PPEs and such, so the less exposure that you can have there, the better. So there. If you have a cyst that looks really, really mega inflamed, very red, very painful to the touch, get medical care just to rule out the possibility of it being a staph infection.
And then MRSA at that.
And MRSA, which is harder to treat. Definitely for acne, especially if it's recurrent, see a doctor, see a dermatologist in particular, to make sure there isn't a contact dermatitis that's aggravating the condition, causing the dryness while you have the acne, accurately identifying, is it plugged comedone, is it hormonal acne, is it sweat acne. It helps to know exactly what it is so you know how to treat it, okay?
I underscore what you just said about, this is your face, and quality of life has been shown.
For some of us, even here.
Quality of life studies have shown that people with really, with acne and all of that, their quality of life is almost as bad as people with serious diseases like diabetes or cardiovascular or hypertension. So, many of the people who come to see me eventually, I realized they've been using one product after another because this was recommended by so, and this was given by that, and this was blah. Don't bother with those things, you know. Go to a dermatologist,
Get a proper
get a
diagnosis.
proper diagnosis of what is
Prevention,
what are the
prevention,
factors.
prevention.
Right. What are the factors
Internal
that
and
contribute to this?
external. Yeah.
Correct.
Okay. We hear a lot from clients, including here, I think Resting Beach Face also mentioned, I got acne, I used this product, I got acne right away.
Right.
Tell us a little bit more about that. How does that work?
Okay. There are two kinds of primary lesions in acne. There's the comedone is common to both, whether it is due to just comedone formation, which means over time of using a product, you begin to notice whiteheads and blackheads in the face.
And that
That's-
takes time.
Right. Whereas with the acne, the immediate result of getting an immediate inflammation or whatever, that's probably an irritant, contact dermatitis from any of these things that we've already mentioned, so that inflammation comes big time and produces first, after the comedones, the papule, a little bit of a bump, and then a pustule with a little bit of an oozing material there, and then cysts.
Right. So, okay, to be clear, because we hear this a lot, hey, I used this product and it broke me out. For comedonal acne, it wouldn't happen overnight. It would be over time that you notice an increase in clogged pores, right? If you use something that causes an immediate reaction, it may not be the last thing that you use. It might be stuff in other products that you're using that's causing an underlying irritation, or that you're building up to a full-blown allergy to it, or you're disinfecting so much and all of that in the air is there, so that whatever you apply at the end causes a reaction. And the reaction can be inflammation of the follicle, looks like acne, it can be redness, typical rash, whatever. So it's unlikely that something that you use gives you acne right away, right? It's usually a little more complex than that.
Let me add to that. You must also remember that what researchers have now found is that there is already inflammation of what we call a microcomedone. That's a tiny little comedone, but not quite visible yet to the naked eye. So then, in addition to that, that was established for a while already, but they've also found out that when they do biopsies of the skin, before that microcomedone is noted, there already is inflammation. What does that mean? It means that our body is exposed to all of these things that we're talking about, so that inflammation is generated already, and that part of it is what you should be paying attention to.
Right.
Pay attention to your diet early on.
It's a, again, holistic approach. It's not just what you put on your skin or not. That's why it's good to see a doctor, dermatologist, who can really do a proper interview. And Resting Beach Face, for your concern, definitely drop us a DM, because what we'd like to do is see what else you're using that might be causing that breakout. St. Frank Floyd, how do you know if it's hormonal or sweat acne? Is there a difference in the way it looks?
Sweat acne is totally different diagnosis. It's not even acne. It's called sweat folliculitis or pityriform folliculitis.
It could also be keratosis pilaris, which isn't even acne,
Right.
and it's dry skin.
That's right. So go to a dermatologist
Go to
and
a
have the proper diagnosis done.
Guys-
But sweat acne is properly a folliculitis.
Look,
It's
misdiagnoses happen even among like dermatologists, right? And they are well trained to recognize, it's not that, it might be this. Let's test, let's try this instead. Imagine if they go through that, your own self-diagnosis is probably not the thing to rely on. Okay, so it's best if you're, pityriform folliculitis, keratosis pilaris can kind of look very, very similar, right? Big cysts and MRSA can look fairly similar. Hormonal acne, a lot of that comes from talking to the dermatologist, and they go through your history and then your age, and they factor in things. They might even ask you to talk to an endocrinologist for certain tests to confirm other underlying
Internal
things.
problems.
Yeah, so it's not something you can kind of just see and guess. Like, sorry, but you do need to see a dermatologist for that. Hi Doc, says Simina. Can you recommend food that has anti-inflammatory effect for acne? Yes.
Yes. Fresh fruits, not as much as the vegetables.
Everything that your lola ate. So, Fresh fruits and
fresh
veggies.
fruits, because it's still a carbohydrate. So have some fresh fruits, have more of the vegetables, because they have more antioxidant properties
The
as well.
rawer, the better.
Yes. The closer to
VCO,
table, the better.
Virgin coconut oil has shown to be anti-inflammatory. That study she mentioned earlier is on VCO in the diet for cooking. Very helpful. Fresh fish more than meat. Sweet potatoes, very good anti-inflammatory, antioxidants. Basically all the stuff we already know.
Right.
More fish, less red meat, no processed foods. A lot of junk food isn't even food. It's not recognized by our bodies as food, and it's highly inflammatory. So a great easy one to follow, easy in the sense that you can find it online, is the Mediterranean diet.
Yes.
Substitute olive oil for virgin coconut oil on your set.
Right.
Okay, I'm sorry, I can't pronounce, but
I have to tell you this. Oh, I did another human study actually about 2016. And what we did was we followed the Draylos protocol. But instead of using products that contained ingredients that were said to be comedogenic, what we did was we actually did just oil, something very basic so we understand, because there's always an oil somehow in your product. We did a study on oils that included castor oil and avocado oil and safflower, sunflower, and coconut oil, olive oil, and almond oil. Guess what was comedogenic among all of those? It turned out to be olive oil and almond oil. So a doctor friend of mine was saying, why, what's wrong with almond? That's a very, very good oil. The fact is that olive oil can be comedogenic on the skin. If you want to know more about that, you can refer to me and the more recent researches which show olive oil
studies coming out, guys.
from the monounsaturated part
Okay,
of olive oil.
We
The
can't
oleic
get
acid.
into oils now because
And
it's
almond.
another show.
I see. Okay, almond oil has a lot
Let
also.
me
of
answer
oleic
first
acid.
these people because we have to go soon because I know you have research and calls. First, shout out to our partners in Canada, High Principle
Hello.
Brands, our distributors in Canada and Singapore. Thank you so much for tuning in at your time zone too. So Gino Gasperanza 99, does birth control help acne and super oily skin?
It depends upon the kind of birth control. For this, you will have to go to, again, your dermatologist and maybe a gynecologist to tell you what you may have inside, like they will do the ultrasound for PCOS. So if that turns out...
Polycystic ovarian syndrome.
Right. If that turns out to be positive for that, that would mean you have more androgens. So that's the hormone that will affect you.
I was put on birth control pills actually in part to help control my acne.
Right.
And also towards the second half of that question, remember it's not necessarily oiliness that is causing the acne. A lot of things cause acne, and in the end of the day, it is an inflammation of the hair follicle.
Correct.
So you're looking at no allergens, no irritants, not comedogenic, and don't trust the rabbit ear assays of the 70s. Look at the newer ones by Dr. Draylos or human-controlled trials. Look at an anti-inflammatory diet, getting enough sleep. Definitely look at hormones and other possible underlying conditions. For that, you need your doctor. So it's not, my skin is so oily, that's why I have acne. Not necessarily, okay? It could be more complex than that. Hijopi, I'm an inspiring dermatologist, wondering about your credentials. Where'd you get your education, residency, practice, etc.?
Okay. I am a Filipino, live here. But so I went to the University of the Philippines College of Medicine for my medical, degree. Then I went to Cleveland at the Cleveland Clinic. I did the 3 years of residency. By the end of that 3-year residency, I had already 2 articles that were published. One of which was on hair analysis of hair in hair loss. And that won the first prize, you can look this up, in the cutest manuscript contest for that year. I think that must have been in the 1964, like that. So I had 2 articles already. And then my doctor
That's why she has like
head
200 plus.
said, you have such a good interest in dermatopathology, why don't I refer you to, and I became a fellow of Dr. Herman Pink, who was one of the pioneers in dermatopathology in the United States. And when I was with him, I did 2 more studies. So by the time I finished my residency and fellowship, I had 4 published articles. I came back to
No
the
pressure at all.
I came back to the Philippines and began to realize, oh gee, this is not the same kind of skin I was exposed to in Detroit as well as in Cleveland Clinic, where there were more white people, and in Detroit where there were more blacks. So I said, I need to study brown skin, and as it turned out to be, there is really a wide range of brown skin that differs in the way they produce the pimple, the acne, as well as the post-inflammation marks. That is quite a terrible thing to do, because that's what bothers most people with brown skin. Interestingly, as I studied brown skin in the tropics, I found out that most people in the United States will classify as brown skin as Fitzpatrick 4, 5. It turns out that I'm doing all of these studies.
There's a lot. The point is, very credentialed. If you Google her, you'll see the 200 plus. I'm
very
going to
well
cut
published.
this short because we have just a few more minutes left. I want to make sure I get your questions in, and then I'll do a summary at the end and mention our products again. But do Google her, and if you want to get in touch with Dr. Viralia Rawa herself, DM us, and we'll see if we can make that happen for you. By Art of Cyril, is calcium bentonite clay mask safe to use? Same banana, there's no way for us to know it.
We don't know what ingredients there
Yeah,
are.
we don't know what's in the ingredients, and even looking at the ingredients, you don't know what the raw material really is. There could be hidden allergens in the raw material, so it's best to ask the manufacturer.
And ask your dermatologist to help you.
Yeah, isotretinoin for acne. As doctor mentioned earlier, some acne benefits from isotretinoin, other antibiotics, and Accutane and things like that. But this is really something that a dermatologist has to manage with you, because
fantastic.
they have to check, among other things, that you have no plans of getting pregnant. You are on birth control to minimize the risk of getting pregnant, because these are teratogens, some of them. So you want to be careful. They can affect the fetus. So not something to play around with on your own.
And the dosage has to be proper.
Exactly. Okay. Another one from... Is it better to ask the derma about skincare than to just keep trying a bunch of products?
Absolutely.
Absolutely. Or at the very
This
least...
is your face.
Or at the
Go
very
to some
least sample.
expert.
But yeah, especially if you have either sensitive skin or a history of acne or sensitivity, it really is best to be managed by a dermatologist. Get a patch test if the dryness or reactions are consistent or chronic, and definitely if you're not sure what type of acne it is, get the proper diagnosis and the proper care. Remember, there could be underlying conditions you don't even know about that might be related to your thyroid or other hormonal issues.
We haven't even talked about rosacea.
Rosacea acne,
There is
that's right. It's
rosacea
a whole
acne
different
as well.
thing.
And in that, I really treat them with the antibiotic for bacteria, then for the antifungal medication orally, and then if they still persist, I'll treat them for that Demodex mite that is in the follicle and die.
Okay. Linz Kelly has a great one, I think. What is the best way to come off of acne medications like Anzi, spironolactone, and tretinoin?
Spironolactone has become a product that we need to give for many of our patients with acne. It is it's aldactone. It's called aldactone, and what it is that it helps decrease the androgens in your skin. So it helps quite a bit. Isotretinoin is another one. Oral antibiotics, make it short. Don't make it too long. There are new products now that are coming out that are antimicrobial that do not produce resistance. Like, of course, benzoyl peroxide, the old one, continues. It doesn't produce resistance for the organisms. In addition, I really like using coconut oil, whether you're dry skin or oily, maybe a little bit less of it. Because if you're inflamed, if you're dry skin, what that signals to you is the barrier has been compromised and it cannot regenerate the water there. By putting the coconut oil after you splashed yourself with some water on your face, you actually have an amazing oil that has multiple functions for barrier repair. It is like a palisade that stays on the surface because it has short to medium chain fatty acids. And therefore, unlike other oils that are, long chain, for instance, because long chain fatty acids curve at the unsaturated part. So they cannot do this nice stacking of the fatty acids that forms a nice palisade and stuff
Yeah.
to help you have a barrier.
Okay, jumping ahead to hijopi, which is why it's unlikely VCO would, quote, cause eczema to spread. So if you can, go look at our IGTV on our live stream on eczema and psoriasis, because that's not quite how eczema works. It is an allergy of the skin. So it is unlikely that anything would, quote, cause it to spread like that necessarily. Also VCO, no, not all coconut oils are created equal. If you have hypersensitive skin, you want to avoid RBD, which is refined bleached deodorized coconut oil, which is usually cheaper and it usually smells good, although now sometimes they add masking fragrance to hide the smell, which is an allergen. So look into that for sure. Thoughts on squalane oil?
Squalene.
Yeah,
It's
from
part
St.
of
Frank
the-
Lloyd.
It's part of the lipids that form the barrier that's compromised due to lots of things.
Okay,
Yes, you can look for that.
I'm gonna close this up soon because I know she's gonna kill me. She has a call that she's actually on right now and she's sneaking away for us, so thank you very much.
You're most welcome, Lydia.
But let me summarize very, very quickly before she goes. If I make a mistake, you can correct me. Number one, acne is an inflammation of the hair follicle. Comedones, or rather blackheads and whiteheads, are both plugged comedones, blackheads being open and whiteheads being closed. Blackheads can also be in hyperpigmentation on the inside of the pore. Cysts and things like that can be internally caused. Hormones, inflammatory diet, junk food, processed food, not getting enough sleep, 7 to 8 hours of sleep, mental stress, all of these things. You could also have an underlying condition, PCOS, polycystic ovarian syndrome. Dermatologists might ask you to talk to an endocrinologist, gynecologist, and sort of come together on the best way to treat you. Some acne does require antibiotics to treat, or Accutane, or isotretinoin. A dermatologist needs to be the one to identify that,
Correct.
have the correct dosage, measure the risk factors, etc. Otherwise, you really need to focus on prevention, non-comedogenic stuff. Everything from shampoo, conditioner, toothpaste to makeup. But be careful. A lot of the stuff online that is listed as comedogenic is based on old rabbit ear assays, which are incongruent at best. Look at the Dreylos ones or the human control trial ones for comedogenicity. In addition, look for hypoallergenic, allergen-free, because a lot of the irritation can cause that inflammation in the follicle and contribute to acne. And if you have dry skin because of the irritation, it's harder to treat the acne, so you might need a patch test, okay? And I'd definitely see a dermatologist because some things look the same. Cysts and MRSA, keratosis pilaris, and pityrosporum folliculitis, a lot of these things can be mistaken for each other. So on that note, unless I've said anything that needs major correction.
Yes, I would just like to say, because there was a young doctor who asked me my credentials, I'd like you to know that I'm very published abroad. You can look me up. But before going, I'd like to say thank you again to my mentors in the U.S. After Dr. John Hazarek at the Cleveland Clinic, and Henry Rennick was there as well, and Wilma Bergfeld. I had also more learnings on contact dermatitis and irritations and all that from Dr. Chito Ponciano Cruz of University of Texas, Southwestern, and Dr. Berg Stresser. Hello, sir. And then also my very favorite dermatologist in Oregon University. Her name is Dr. Franz Dorr. She's an amazing teacher, fantastic. If you find anybody who has been trained by any of those names I mentioned, those are the ones you choose. And of course, any other dermatologist. Thank you.
All right. Thanks, Mom. We'll see you next week. I don't remember what we were talking about next week, but we'll be repeating the contact dermatitis and patch test one. So stay tuned for that.
That's right. Very important.
Okay, I can go through some of the other questions here quickly. The anti-acne diet, again, look up the Mediterranean diet. It's just a good one, but replace olive oil for coconut oil.
Yeah.
Can acne marks be removed? Yes, if they're dark spots, but oh my gosh, you might need a photo patch test, prevention from photoallergens, and there's a new machine called an Energet, which is pretty good for the textural marks. Preventing acne while wearing a mask or PPE. Okay, first, Prevention, prevention, prevention for sure. Then, do you have any other tips?
Yes, I just want to say that, remember, it's inflammation that is the main problem. So azelaic acid is one of those anti-inflammatory because it affects the innate immunity response of the skin, which is the very first inflammatory pathway that goes on. There is a product, so you can use azelaic acid products together with these things that we talked about. The problem with it is that it's an irritant. You know, you feel stingy and all of that at the very beginning of using those azelaic acid. So I found out that a salt of azelaic acid called azelloyl diglycinate continues to also, even though it's already a salt, it continues to have the same anti-inflammatory properties. So very often I'll include azelloyl diglycinate containing products with acne treatment, and the beauty about it is that the scarring, because that's also inflammation, the scarring, the redness you're talking about, and the pigmentation post-acne is minimized, especially if you also add a sunscreen to the acne regimen.
I'm gonna kick you out now, so you can go back to work. I don't get yelled at. Love you. Thank you. Mwah.
Bye-bye.
All right.
Thank you, everyone.
I will be staying on, guys, to talk about products here very quickly. I did the summary earlier. If you have any other questions, DM us. A lot of this stuff is on vmvinskin.com, which is our blog, which we write a lot with input from her. Again, products for acne that we normally recommend. Shampoo and conditioner that's irritant and allergen-free, superwash and essence. If the acne is around the mouth, chin, or jawline, essence toothpaste. I use this myself because it tends to be my problem area. The Super Skin Care cleanser or scrub of your choice for your skin type. Most people with acne tend to prefer the green line. And then I personally use the 1635 scrub. Other people love the ID scrub. These two things are actually on sale now on the website. And then toner. I use both the ID toner and Super Skin toner. You can actually combine this with Illuminance toner. So you can do ID toner and Illuminance toner if your concern is dark spots. Go again, vmvinskin.com has suggested regimens that you can look for. ID lotion or the moisturizer for your skin type would follow next. And then this magic baby, ID Monolaurin Gel on face, back, butt, thighs, arms, chest, everything. Red Better Spot Corrector for bumps. And your sunscreen, Armada for sure. And remember that trick I taught you guys about ice inside a napkin with some virgin coconut oil for a cold compress. So we have all that information on vmvinskin.com. We are on sale right now, vmvhypoallergenics.com. Internationally, vmvhypoallergenics.ph in the Philippines. Remember to follow us on social. And if you want a teleconsultation with my mom, DM us. We can make that happen. Or with another dermatologist we work with at VMV Skin Research Center and Clinics. We'll be doing live streams every week. Friday, 9 a.m. in Manila, 9 p.m. Thursday night, Eastern Standard Time in the States. And remember, you can send us your patch test results and we can customize recommendations for you based on your particular allergens. And if you want to chat with me about whatever, I'm on Laura at VMV on Instagram, etc. So yay! So we'll see you next week. Don't forget to follow us, sign up, and yeah, submit your questions and we'll do our best to answer them. Thank you very, very much. Bye.